Hey, it's Dr. Bill with just the tip of urology school. And today we're going to discuss infertility. The subject in urology can be very gratifying, but likely stressful to the patient and for the partner, and many times stressful for the provider because they're not really sure what to do. We all grew up, or most of us grew up, with our parents giving us guidance and being careful when we became sexually active, not to get involved in an unwanted pregnancy. It could ruin your life. It could screw up your timing on all things and delay progress in what you want to achieve in life. And now we have couples who, for whatever reason, have started out in life together. They may have delayed conceiving in an effort to achieve other social goals in their lives. And now they're having frustration with the fact that they can't start a family. We always look at couples when they come to us and get an idea of how long they waited to present for an infertility evaluation. Really, we should be looking at, based on the definition of an infertile couple, of about a year of unprotected intercourse. Many couples will come prior to that, and they're already frustrated. Some may be embarrassed. Some may be concerned about the cost. Others will be concerned about how long it actually takes to undergo an evaluation. And we have to undo a lot of disinformation. Many have been told that it's a quick and easy evaluation, and there's no problem with that. But the reality is, sperm takes about 90 days to make. And so not only do we have to figure out what the issues are, we have to impact some sort of change. And once we've done that, there is a frustration in the time involved. Also, we see frustration usually on the male partner that it is an on-demand sex act. Couples are geared towards being sexually active during the largest opportunity for fertility, and that's during ovulation. And so many people are pulled from their normal activity to come home and have sex, so we have the best shot of having a child. Many are frustrated by the previous amount of disinformation that they've been given. A lot of times, actually, that people are given hormone replacement therapy by many non-urologists, and unfortunately, some urologists who are just not up to date on the issues of exogenous testosterone. So there's a number of roadblocks that, as a practitioner, we need to be aware of and have to deal with. We need to be aware of the association of infertility with erectile dysfunction, testis cancer, and cryptorchidism. We need to look at a full, in-depth history of both patient and partner, looking at previous pregnancies, looking at history of male siblings that may or may not have children, any concerns of genetic abnormalities in the family, a history of genital trauma, or a history of genital surgery, any childhood illnesses that may be significant. Query about the kind of work they do, how much exercise they get. Is there a history of environmental exposures, their smoking and alcohol use, and especially marijuana use? There's a lot of data, though confusing, there's a lot of data that looks at the potential negative changes that occur both from a sperm production point of view and a hormonal point of view with use of marijuana. Exposure to chemotherapy or radiation, exposure to COVID over the last several years. And don't overlook the importance of emotional stress. It is a huge negative factor when we talk about conception issues. On history and physical exam, you want to look for varicocele, the presence of vasa bilaterally. What the testes look like are there epididymal cysts, hydroceles, evidence of hypospadias. Where is the urethral meatus in position with the glands? And overall health, including issues of obesity. Understand the terminology. Assisted reproductive technology. Again, you're going to have patients who've done their homework. They've Googled you and they've Googled the topic, and many female partners are going to have their own gynecologist or obstetrician who's working with them and guiding them on what they should be looking for. So be familiar with the definitions of in vitro fertilization, intrauterine insemination, embryo transfer, ICSI, MESA, TESA, all of these things of surgically having the opportunity to extract sperm and handing that to the female embryologists and reproductive specialists for transfer of the sperm that you harvest surgically to the patient's egg, or ICSI. Be aware of the need to have an understanding of the endocrinologic factors. So look at prolactin, LH, FSH, testosterone. Understand the sperm analysis and the importance of sperm concentration or count, ejaculatory volume, presence or absence of leukocytes, the acid-base balance, and the motility of the sperm. There's a lot to review. There's a lot to understand. Like everything else, look at the basics, but understand with a little bit of patience and a ton of compassion, this can be a very cool aspect of your urologic career. As always, look at what the AUA offers, look at what the up-to-date apps have to offer, look at the core curriculum in fertility. Take it slow. This is Dr. Bill with just the tip of urology school tackling fertility.